studies have shown that your risk of melanoma can increase 75% if you start tanning in tanning beds before the age of 18.
I think because I'm so young that I kind of just brush it off. I don't think about what could happen, even though I should.
That was Tori, an 18-year-old who tans up to 2 times a day in a high-powered tanning bed. She and her family agreed to participate in a health scare experiment designed to help her stop. But when we found she had a suspicious mole on her back, we decided to cancel the experiment, send her directly to dermatologist Dr. Jessica Wu. Now, Dr. Wu just got the results of the biopsy. She's about to deliver them right now in our waiting room.
Hi, Tori. Hi, ladies.
Hi.
How are you? Good, thanks. I know you guys have been waiting for the results of the skin biopsies, and I just got the diagnosis. And it turns out the good news is that the mole on your back that was suspicious is a benign, harmless growth. However, the bad news is that that one on your arm that you didn't really notice is a dysplastic nevus, otherwise known as an atypical nevus, and that's a precancerous growth. So the significance of that is that you are potentially at greater risk of developing not just any skin cancer, but melanoma, the most deadly type of skin cancer. From now on, we've got to examine your skin from head to toe, like we did in the office, remember that? Every 6 months for the rest of your life. So consider this your warning sign.
And Dr. Wu, why don't you go ahead and come back out to the stage, and ladies, if you would join us as well, we can talk a little bit more about this for everyone else's edification.
Hello there.
So everyone, Tori, Dr. Wu, thank you. Do you understand exactly what Dr. Wu was describing to you back there?
I do. It's shocking. I was not expecting that.
You know, that mole wasn't necessarily big. I think a lot of people would look at it and say, oh, it's not that big, it's fine. But why were you concerned?
It was irregular, it was asymmetric, and it had features of what we call an atypical nevus. It was suspicious because it didn't look like any of the other ones, and that's why I did the biopsy, and luckily we did.
And the one thing I want to emphasize to anyone watching is that if it's caught early, you can cure it, but if it's not, it can truly be deadly.